The World Health Organization defines meningitis as inflammation of the brain and spinal cord membranes, typically caused by viral, bacterial or fungal infection. Meningitis can be transmitted by air, especially from respiratory droplets from coughs and sneezes. Some symptoms include fever, headache, and stiff neck. In the Upper West region, the disease has remained one of the major health challenges, killing more than 30 people annually. In the year 2020, for instance, more than 40 out of the nearly 400 persons who contracted meningitis in the region died, attracting the attention of Ghana's parliament, which called on the health ministry to find a lasting solution to the condition. However, it appears there is still much to worry about, as some districts have started recording the disease.
Yes, we are in the meningitis season. Some of the districts have started reporting suspected cases of meningitis, and we have been investigating and responding to all the cases. What I would say is that currently no district is in an outbreak, has reached an outbreak threshold. However, Nandom district got an alert level in week 1 and then week 3. We have investigated and responded. What I will say again is that no death from meningitis from the beginning of the year up to now.
But how prepared are health facilities in the region to combat another meningitis outbreak this year?
What is important is to prepare for the season, and this year we prepared well, train our lab technicians, train clinicians to be able to pick cases early, and then we also have the drugs used for management, and we're also educating the general public to report early. And so once they come early, you start the treatment, they recover, and so on. So that is what we are doing this year.
Despite these assurances, some residents, especially those in deprived communities of the Upper West region, say the time has come for government to find a lasting solution to the disease. Meningitis does not only affect its victims, but also unleashes wreaking havoc on the families of the affected persons. I am here at Zambogo, a community in the Nodoli Kaleo district of the Upper West region, where a 13-year-old girl died of the condition last year. Her father tells me he has been living in self-denial since the death of his beloved daughter.
1 year time lang ambie dem bachibe. Abie bachibu ne to. Aven namante ha abie la to emanu bachirensan. Amven Zimbabwe okay. Abie mamanga an ele atruine yare kweten. Abie magbele chinnu hin wo pampana. Chaman abie la man namante ha wolen mambal na abie. On wata taman bankan ayan o da tare dibu. Chon le ngona tuware. Che na ngona yan yara kombang bama. Che mayen na kuna kure gwamnati ka anyubel balo nga wagara o manwa. Ka gwamnati ndamban tar sombo ada botti he ada kuti ka batu man chog ni azaka abalo nga manwa cheta tuwante nti aleda ele sombo yaga ada kuti.
According to health experts, meningitis has a fatality rate of more than 60%. Ibrahim Muniru is among the very lucky few who survived the condition.
I think government should invest more on education of meningitis. People should get to know more about meningitis. As I'm seated today, I sometimes feel that the aftermath of the virus is still affecting me. I've realized that how sharp I was, I realized that it has reduced, which I know that it is as a result of that particular disease. When I was a sports boy, at a point in time when I have heavy exercise, I sometimes sit and I feel that my bones were weak, which I know that is as a result of the meningitis some time ago.
So how well are inhabitants of the Upper West region informed about meningitis?
Because 2024 kwen ba jeng aga na ba le jara anan pie ana ata o tolo man wa na siesa ni gbelu balo a tolo man ma bi o ma yalan kar man yo to ko ki na jenjo ayo de ngwar cha ba geji ka se opiara ke bo kwa abi apiale ma ka bibili wo e ko ne nyu kwa ke kukunyu kwa ke na ma ne nyu kwa
CFM ba longa anwa karo wono ko wen akora nba tayala zakala tana anyana tane boran karo kon kwa government ko di somo kanga aba atin ayi akwa hospital nba kwa e wala ka na tuan kabana to kan ne zakala na manga hospital na ka ba idawro kan ne za na manga hospital ko to chago asai CFM ba lonne.
As Ghana continues with the fight against the COVID-19 pandemic, it appears the Upper West region has more to worry than the pandemic, as cases of meningitis are recorded in the area. The residents are therefore calling on government to equip health facilities in the region with vaccines to prevent avoidable deaths in the region. Reporting for Citi News, my name is Latif Mahama, Zambogo.